So as I told you guys, we're going to have this topic that we didn't talk about yesterday. On your infographics, you might have seen that we have separate topics between medical and surgical treatment. However, I don't think it's worth it to um, make to go deeper inside this kind of stuff because you already know what the difference is between medical and surgical treatment, right? However, we're going to talk about this today, and I hope you participate. And when we're done, please. We're going to have our practice class, okay, about this one, and some people missed our some of classes from the last week. So let's get started. We're going to make it real quick, okay? So what is medical treatment? We have actually to make a difference between medical treatment and therapeutic. Can anybody tell me what therapeutic is? Anybody, guys? What do you understand by the word therapeutic?
Maybe it's relating to the healing and the disease.
Okay, does therapeutic involve medications?
I think so.
Okay, great. So Risa was right. Actually, one small part of therapeutic is related to medications, okay? However, as I told you, it is a really small part. When we're talking about medical treatment, we at least most of us only related to medications, right? Some specific medication for a determined disease. Okay. However, that is not the best way of treating a patient because we have to take into account that this patient might not need only medications. Our all of our patients do may need medications. However, that is not the only thing that they might need. They need some other things, some other topics you need to get involved with. Okay, so therapeutic actually is in some books you're going to even read that some authors consider therapeutic an art, okay, because it is not only related to giving your patient some certain type of drug or medication. Your patient needs far more than that from you guys, okay? So what is actually therapeutic? When we're talking about medical treatment, as I told you, I'm sorry, there's a spelling mistake here. It's actually the use of prescription drugs, okay, or medication. And when we're talking about therapeutic, it is not only the use of medications. It is also related to diet, modifying the lifestyles, physical therapy, and some other uh, topics related to it. So, what is medical therapeutic? It might be related. For example, this is the easiest example I found to give to you. Okay, when a patient has hypertension, for example, you have to look after your patient's physical activity, weight loss, medication, of course, tobacco use, nutrition. So as you can see, it is not only related to medication. That is therapeutic, okay? So we're going to talk about each one of these. And as we're doctors and the most scientific part of this about therapeutic is related to medication. That's the first thing we're going to talk about. So here we have some medications in hypertension. And we have ACE and ARBS. Does anybody know what these letters stand for? Hello? Hello, guys. I know you know. I'm going to ask each by one. Okay. So, Brisa, you already participated. Sorry, Danitza Burgoa. I know that you know this.
Um, I don't know how to say it in English. I know the name of both, but
Okay.
in Spanish.
Okay. What would it be in Spanish?
The ACE, I guess, los ARA2, antagonistas de los receptores de angiotensina 2.
And the first one?
Sería el losartán y en alapril, los IECAS inhibidores de la enzima convertidora de angiotensina.
Okay, so the first one is really easy for you to say it in English. Could you try?
Angiotensin.
Yeah.
Converter.
Converting. ING. Converting.
Converting enzyme.
Enzyme. Yes. Angiotensin converting enzyme. Okay, great. Thank you, Danitza. So, as Danitza was telling us, and she was right, this kind of medication, actually, most of these are actually first line medications for hypertension, right? So what does, well, as you know, pharmacodynamics studies, a small part of pharmacodynamics studies the action mechanism of any kind of drugs, right? So here we're talking about, for example, enalapril and losartan, as Denise was telling us. You call the next one beta blockers, okay? Here's also spelling mistake. It's atenolol, right? And it lowers. Can anybody tell me the action mechanism of beta blockers? Okay, Danitza Zambrana, are you here?
There is a central one in a burger.
Hello?
Yes.
So Danitza, could you tell me about the action mechanism of beta blockers?
Yeah, there is a central one and periphery one.
Sorry, I didn't catch it. Could you repeat it, please?
Oh, okay. There is
I'm sorry, I can't hear you. I think you have problem with your microphone. Yep.
Central one and peripheral one.
Sorry, Danita, I didn't get it. I don't know if anybody could hear what she was just telling us. Okay. Okay, I'm really sorry. But yeah, I mean, you participated, right? Okay, beta blockers actually block the beta receptors, right? That are supposed to join, for example, in Spanish would be adrenalina, right? Adrenergic stimulation, right? So since these receptors are blocked by the drug, it diminishes one of the first five main characteristics of cardiac physiology, which reduces the heart rate and, for instance, lowers the blood pressure. Okay. And what about calcium channel blockers? Actually, we have two big families here. Can anybody tell me those two big families related to calcium channel blockers? Maybe in Spanish. I mean, okay, let's go on to Diana. Diana Gonzalez.
Hi.
Hello.
I gonna be honest, I don't know, but I search it and
Okay,
I don't know how to pronounce it.
it's okay. Yeah, it's fine.
Dihydropyridines.
Okay, could you say it in Spanish? Doesn't matter actually, because I know that you're a sophomore student, right? You're second year, so you're not supposed to know this kind of stuff yet. But you can tell us in Spanish. It's actually related to one certain molecule, right?
Um, dihydropyridines.
Great. Yes. Okay, so I'm going to say it in Spanish for you to remember. Tenemos dos tipos de bloqueadores de canales de calcio, ¿no es cierto? Los dihidropiridínicos y los no dihidropiridínicos. Los dihidropiridínicos tenemos al nifedipino y los no dihidropiridínicos al verapamilo. Y hay otras moléculas, right? So, for example, nifedipine is actually used for lowering the blood pressure, and verapamil is actually a drug used to treat some types of arrhythmias, because both block calcium channels inside one of them. For example, verapamil is related to calcium channels inside the heart, and nifedipine is related to calcium channels in the vessels, peripheral vessels. Okay, so both could lower the heart rate, mostly verapamil in this case, and the blood pressure, nifedipine in this example. However, for example, verapamil could diminish or could lower the blood pressure by reducing the heart rate. And does anybody remember the blood pressure formula? Marcela Guzmán. Okay, Mariana Sanjines. Oh, okay, I think um, Marcela was just about to tell us.
Do you mean like the blood pressure is took from the diastolic and systolic or not?
Not really. There is a formula actually related to blood pressure. You could say it in Spanish if you want to.
I don't remember about that, or I don't know if I have seen that.
Okay. En Spanish would be presión arterial es igual a frecuencia cardíaca por resistencia vascular periférica. Okay. So any medication that diminishes any of those two main components of the formula is going to lower the blood pressure because it is presión arterial es igual a frecuencia cardíaca por resistencia vascular periférica, right? So in this case, verapamil lowers the heart rate, and the heart rate is frecuencia cardíaca, right? So as the verapamil diminishes the heart rate, it is going to lower the blood pressure, okay? So the next would be digoxin. It lowers the heart rate. And this example, diuretics, they lower the blood pressure, and they have this example in many medical series. We have, for example, okay, you have a patient who has pulmonary edema, for example, and the doctors on the TV say, okay, we're going to use Lasix. I'm sure you must have heard of it. So actually, Lasix is furosemide. Okay, it's actually one of the most powerful diuretics, right? Okay, so as you can see on your left, here we have a mnemonics and related to the words related to the type of drug that we could use for hypertension. So we have A, B, C, D, 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 okay? So here we have the renin-angiotensin-aldosterone system. And here we have the main points in which we can treat our patient with different medications on your left. Here we have the ACE inhibitors, and as I think it was Danita Burgoa that told us about angiotensin receptor blockers, right? Give me 1 second, guys. Okay. So here we have some points in which we can act by the use of each kind of medication, and you all running up this kind of stuff. Can anybody tell me how would you expect to find a patient's renin concentration in, well, our patient's blood? Renin, this molecule, this one right here, which is in the middle, right here, right? How would you expect a patient who has hypertension, his or her renin concentrations be like? They should be really, really low, right? Because renin actually starts acting when the pressure is, come on guys, do you remember? Okay, renin actually starts acting when the pressure is high or low. Can anybody tell me, guys?
I think it acts when the renin just goes low.
Sorry, I didn't catch it.
The renin act when the the pressure, the arterial pressure goes low, and I think the kidneys just through more renin to the to the vessels, I think.
Okay, could you explain me this system, renin, angiotensin, aldosterone? You must have read about it, right?
Uh, in Spanish.
Okay, okay.
Okay. Well, it starts in the kidneys, I think. Bueno, se expulsa la renina y se convierte en angiotensinógeno, creo. Y después en angiotensina 1.
Yes.
Y ahí entra la convertidora de angiotensina y se convierte en angiotensina 2 para posteriormente ir a convertirse en aldosterona.
Okay, and what does aldosterone and angiotensin do? What do they do?
Oh, I actually don't remember that.
Here you have an angiotensin name. Angio means vessel, right? And tensin, increased tension. So when the pressure is low, right? This molecule actually causes contraction of the muscle cells, right? So as you as you were telling us, angiotensin causes contraction of the muscle cells, and aldosterone increases the reabsorption of water, right? To increase the blood pressure. So it actually, the renin levels should be higher when the pressure is low. So in a patient who has hypertension, how do you think renin levels should be like? If this molecule starts increasing its concentration when the pressure is low, then in a patient who has hypertension, we actually should not find renin, right? Because it increases its values when the blood pressure is low. However, a patient who has hypertension, in a patient who has hypertension, we should not be able to find renin, right? According to this. However, in patients who have hypertension, we do find renin in normal values. And what does that mean? It is normal that the patient with hypertension has normal values of renin? It is not. We should not be able to find renin. So the fact that a patient's renin levels are in normal ranges in a hypertension patient, it is not normal. However, in hypertension patients, we have renin in normal levels, which is not normal, okay? So that is the part that we related to medication. However, we already said that therapeutics is not all about medications. Does anybody know what that DASH diet is? It actually comes from the words in English, okay? It is dietary approach to stop hypertension. I know that you must have read about this. Can anybody tell me what this is about? Okay, so this is a diet. Well, this is actually interesting because anything. Well, I know that you went to the hospital and saw a patient's history. You must have read about if the patient has hypertension, of course, um, restricted salt, right? Sodium mainly, right? That is an indication of the of his per treating physician, right? But this diet, which is the DASH diet, does not only take into account sodium, it takes into account calcium, sodium, and potassium. So, as when it comes to calcium, the patient has to take a lot of calcium, however, in low fat milk. Okay, has to increase his or her taking of potassium in grains, also increase the consumption of vegetables, and diminish the, mm, the taking of sodium. Okay, so that is basically the DASH diet. Some studies tell us that the DASH diet lowers the blood pressure between 5 millimeters and 2.5. It is not quite a lot, but it helps. Okay, so weight loss. Some books say that each 20 pounds, which corresponds to 10 kilograms, right? If our patient loses 20 pounds or 10 kilograms, will diminish or lower his or her blood pressure by 15 to, well, sorry, by 1.5 per 1 kilogram. Okay, it is not that it, well, there are small numbers, however, all put together, they help at the end. What about tobacco use? The use of tobacco increases blood pressure nearly 15 millimeters. Okay, so when our patient stops the use of tobacco, it's kind of difficult for a patient to stop doing it, smoking. So when a patient stops smoking, it could really help by 15 millimeters, okay, on the systolic pressure. And the regular physical activity also reduces when a patient has on the daily basics, physical activity by 1.5 to 3 millimeters. Okay. Of course, this has to be for a quite a long time. However, if you add the all the numbers that I told you, it could really help at the end of the day, right? In addition, of course, to the medication. So I'm going to ask you, in this actually means chronic kidney disease, okay? Asthma, chronic obstructive pulmonary disease, gout, peptic ulcer, heart failure. I'm sorry, there's a mistake here. Let me fix it. Okay. So I want you to tell me one by one. Okay, let's get, okay, Brisa, could you tell me the therapeutics of any of these diseases that you might find interesting? Not only medication, because that would be just medical treatment, right? I want you to tell me the therapeutics in any of these diseases.
Oh, okay. In asthma, we use bronchodilators. I don't know how that is, how to say
Dilators.
that in dilators, and steroids too.
Okay, which one would be the main treatment for asthma?
Salbutamol.
Not really. Actually, the treatment, and when we're talking about medication, right? That you told me salbutamol, which is beta agonist, right? However, the basic medication for asthma are corticosteroids, not this kind of bronchodilators, right? This medication is actually only for an acute asthma. However, the main point of the treatment of medical treatment of asthma is actually corticosteroids. Okay, the one that you told me is useful, but only for asthmatic crisis, and we do not want that to happen. So the basic for asthma treatment is actually corticosteroids. Okay, okay. So medical treatment is corticosteroids and the one that you told me. Anything else about therapeutics? Not only medication.
About asthma, right?
Uh, you chose asthma.
If they smoke, they have to stop doing that, and the
Great.
oxygen therapy, it works too.
Okay, great. Awesome. Anything else that might help your patient?
Right now, I can't remember. Like I remember about the treatment. You have to follow this SABA. I think that's the name of their contraction.
Yes, a short, right? That one, right? The S is short, right? What's next?
Yes. I don't know. I don't remember.
Okay, I think someone was raising her hand. Okay, Mariana.
Uh, well, I would like to say another therapeutic in the femur fracture. Well, not
Yeah,
about the main treatment most of doctors gave patients at the beginning of this situation, but over when the patient goes almost like 2 months more, they could go to physical therapy, and by then they are not going to be immobilized. I don't know if I'm saying it right,
what do you
but
want to say?
like enyesado.
Oh, like you were in a cast.
Mm,
You remember
yes,
we talked
yeah,
about
okay,
casts, right? Okay,
yeah, and well, we could do a lot of things like to relieve the pain that it could be there, or we could make him or her do exercise to um, have again the ability to walk or run or just continue with his or her daily life.
great. Yes, I actually wrote this femur fracture for you because I know you're going to be physical therapist. Okay, great. Thank you for participating. Okay. What about Danita Burgoanel?
Um, Rheumatoid arthritis.
Okay.
Um, we uh, we have to treat this disease with Immunosuppressant?
Immune suppression, okay.
Suppression, okay.
Okay, with
Like
what kind of medication?
can be non-steroidal anti-inflammatory drugs that
Okay,
are gonna relieve the pain, decrease the inflammation, also steroids,
great. Okay,
like prednisone.
actually, the based treatment is related to
Or
prednisone, right? Because it is, well, we have this orally, right? Prednisone, okay. Okay, actually, those two are for pain and diminished swelling, right? However, we do have some other medication to stop the evolution of this disease. Fármacos modificadores de la enfermedad. Uh, there's actually a drug that starts with the letter M. Do you remember?
in Spanish, metotrexato.
Great. Yes, that one actually is the, the base of the treatment for this disease. Okay, great. Um, would you tell your patient to stop smoking, for example, or it is not related to rheumatoid arthritis?
Mm, Yes, I would tell my patient, but I really don't know how
How it
smoking
will be
affects.
related?
I'm not sure. Yes, I'm not. I don't know.
Okay, yes, you do have to tell your patient to stop smoking. Uh, do you remember the laboratories that you should ask for in a patient with this disease?
Uh, well, the basic, a blood test, um, rheumatoid factor,
Okay, great.
um,
There's another that's actually more important than
NT, CCP
great, awesome. That's what I wanted
antibodies.
to get. Okay, I'm going to say it in Spanish for all of you to understand. Maybe you didn't read it. So I'm going to explain it in Spanish, okay? Ok, entonces tenemos para artritis reumatoide, podemos pedir reactantes de fase aguda para ver si la actividad del paciente, o sea, la enfermedad está activa. Entonces podemos pedir reactantes de fase aguda, ¿no es cierto? PCR y demás, que obviamente son parte de los criterios de diagnóstico, por si acaso, para artritis reumatoide. También tenemos como nos decía Danitza, el factor reumatoideo, que de hecho es una inmunoglobulina G que está dirigida contra la fracción FC de la inmunoglobulina G, una inmunoglobulina M que está dirigida contra la fracción FC de la inmunoglobulina G. Y también tenemos los anticuerpos anti-CCP. ¿Qué nos quiere decir estos anticuerpos anti-CCP? Quiere decir anticuerpos antipéptido C citrulinado. Bueno, que estos anticuerpos que son los anti-CCP, ¿qué nos quiere decir? Que hay proteínas, que ustedes saben que las proteínas están hechas de aminoácidos, ¿no es cierto? Entonces, no recuerdo cuál de los aminoácidos es modificado en cuanto a su estructura primaria esta proteína, que bueno, saben, ¿no es cierto? Que las proteínas tienen sus estructuras primarias, secundarias, terciarias y cuaternarias, ¿no es cierto? Entonces, la estructura primaria de una proteína es su secuencia de aminoácidos, ¿no es cierto? Entonces, uno de estos aminoácidos, no recuerdo cuál en este momento, pero se modifica por una enzima. Entonces, esta modificación de este aminoácido lleva a la citrulinización de una proteína. Bueno, entonces se dice que esta proteína ha sido citrulinada, porque en vez de tener determinado aminoácido, ahora tiene citrulina. Entonces, como esta proteína se ha modificado en su estructura, el sistema inmunológico lo detecta como una proteína extraña y empieza a formar anticuerpos contra esta proteína que está ahora citrulinada. Entonces, estos son los anticuerpos antipéptidos citrulinados, por ese motivo se llama así. Entonces, se ha determinado que los pacientes que tienen artritis reumatoide tienen más cantidad de esta enzima que citrulina las proteínas. Entonces, los pacientes fumadores con artritis reumatoide tienden a tener niveles más altos de anticuerpo antidopéptido citrulinado y la hacen una enfermedad más activa y agresiva. ¿Se entendió, chicos?
Yes.
Okay, great. So that is why you should ask your patient to stop smoking if your patient has this disease, okay? Any other kind of therapeutic for this disease?
Physiotherapy
Physical therapy, right?
may help.
Great. Awesome. Okay, so who's next? We have Danitza Zambrana.
Yeah.
Okay, could you, well, you could choose between those that your classmates didn't choose yet. Tell me a little about therapeutics.
Of the peptic ulcers.
Peptic ulcer, okay.
The treatment for peptic ulcer is depend of the cause. The usually treatment will involve killing the H. pylori bacterium.
Okay,
The medication can include antibiotic, in special amoxicillin and clarithromycin.
great. And yes, any other?
The other treatment is the PPAs.
Okay,
For example, omeprazole
great.
and lansoprazole.
Yes, that kind of PPI, right?
Yeah.
Okay, that is the medication. And what about therapeutics? I mean, any other kind of recommendation besides drugs?
The patient can eat uh, cannot eat lemons and tomatoes.
Okay, lemons and tomatoes. Okay, okay. Anything
Mm,
else?
I don't remember.
Okay, do you know where is most commonly located this peptic ulcer?
Oh, I don't know in English, but está en la parte del píloro del estómago.
Okay. Oh, actually, yeah, we might think that a peptic ulcer is most commonly located inside the stomach, right? However, it is most commonly found in the small intestine. And that is something that is kind of tricky, right? Una úlcera péptica puede ser gástrica o duodenal. Y la localización más frecuente es la duodenal, de hecho. Okay. Do you know what the Solinger-Ellison syndrome is? Síndrome de Solinger-Ellison. Do you remember? Do you know?
No, I don't remember, sorry.
Okay. Does anybody remember or know what the Solinger-Ellison syndrome is? Or do you know what a triángulo de Passaro? Do you remember, guys? Triángulo de Passaro o síndrome de Solinger-Ellison? Any of those two? Okay. Okay. So remember when I was telling you a little bit about how the parietal cells work, right? It has a lot of stimulation from the nervous system, from the enterochromaffin cells, and the gastrin related to the G cells, right? So Solinger-Ellison syndrome is actually a disease in which there's like a proliferation of G cells. So G cells produce gastrin. So there is an increased concentration of gastrin. So this high levels of gastrin stimulate the parietal cells that produce acid. So there's hyperchloremia, hyperchloremia, okay? Hypergastrinemia, hypergastrinemia. So this kind of cells, the G cells, could be located inside a triangle, which is Triángulo de Passaro, the Passaro's triangle, okay? So that's why those two are related. Okay, so the next one would be Marcela.
Yes. I want to talk about heart failure.
Heart failure, okay, great.
Okay. Some medications are angiotensin converting enzyme inhibitors, and also angiotensin 2 receptor blockers and beta blockers and diuretics.
Okay. And what about therapeutics? That is what you told me is medication, right? So what about therapeutics? Any recommendation or any other kind of treatment that might be useful for your patient?
Mostly the doctor has to give some advices for the lifestyle to this type of patients. If, for example, start taking care about the health weight and have a healthy diet. And also it could be, for example, limit the amount of salt that you're eating.
Yeah.
And obviously things like stop smoking.
Great. Yes. Awesome. Thank you. Okay, so Mariana.
Yes.
Okay, could you tell me, or could you choose any of the ones that your partners didn't choose yet and talk about the therapeutics?
Well, not really. I don't really know a lot about them yet.
Okay, great. Okay, don't worry about it. For example, I don't know, uh, erythrocytosis, maybe. This is, as I told you here in La Paz, actually, we find a lot of, we get a lot of patients with this diagnosis. For example, we have this medication, actually, I'm going to say it in Spanish for you to learn, okay? En los eritrocitóxicos, nosotros tenemos que tener en cuenta que tienen un hematocrito elevado, hemoglobina elevada, ¿no es cierto? Un conteo de glóbulos rojos elevado. Entonces tienen tendencia a formar coágulos, entonces los tenemos que antiagregar. Entonces con ASA, ¿no es cierto? Ese va a ser uno de las medicaciones, con aspirina para antiagregar, ¿ok? Y también tenemos otro fármaco hipolipemiante, que es la atorvastatina, ¿no es cierto? Que se ha visto que reduce la producción de glóbulos rojos a nivel de médula ósea. Entonces vamos a disminuir hematocrito, hemoglobina y glóbulos rojos con atorvastatina. ¿Sí? Ese es otro uso de la atorvastatina porque saben ustedes que es un fármaco que está relacionado con el perfil lipídico. He elegido esta enfermedad porque lo más útil para los pacientes eritrocitóxicos en realidad es no la terapia farmacológica, sino otras medidas, por ejemplo, terapia física o fisioterapia, que les ayuda a, con terapia respiratoria, los pacientes, bueno, ¿por qué se produce la eritrocitosis? Como un reflejo, como les decía, ¿no es cierto? ¿Cuál es el principal estímulo para que se produzcan los glóbulos rojos? Es la hipoxia. ¿Se acuerdan cuando les explicaba del factor inducible por hipoxia? Cuando hay una disminución de oxígeno a nivel del citoplasma celular. Entonces, cuando disminuye la tensión de oxígeno en el citoplasma, el factor inducible por hipoxia tiene dos subunidades y cuando hay disminución del oxígeno, ambas se unen y van al gen de la eritropoyetina y empieza a ejercer su acción. Entonces, mi punto es que ¿cuál es el principal estímulo para la activación de la formación y liberación de eritropoyetina? Es la hipoxia. Entonces, cuando nosotros pedimos en un paciente con eritrocitosis que vaya a terapia física para terapia respiratoria es para que pueda ventilar mejor y oxigenar mejor sus tejidos y así disminuya la hipoxia a nivel celular y el paciente ya no tenga la necesidad de producir más glóbulos rojos, ¿me entienden? Entonces, terapia física, que es parte de la terapéutica. También, ¿qué podemos ver? La dieta. En cuanto a la dieta, aquí tenemos, bueno, en La Paz por lo menos, no sé, en otros departamentos de Bolivia, pero se tiene la creencia de que la sultana, por ejemplo, ayuda con esta enfermedad. Sin embargo, la sultana, el té y el café son diuréticos. Entonces, como el paciente toma sultana o café o té, va a tender a tener mayor número de micciones, entonces se va a hemoconcentrar más, entonces el hematocrito de hecho va a aumentar, ¿no es cierto? Entonces restringir en cuanto a la dieta, uso de diuréticos. Y estos pacientes, generalmente los pacientes eritrocitóxicos, tienen también son hipertensos. Entonces no le podemos dar diuréticos, por ejemplo, a un paciente hipertenso, que de hecho es fármaco de primera línea, ¿no es cierto? Pero en este caso no, estaría contraindicado porque lo vamos a hacer orinar más y se va a hemoconcentrar más. Entonces tenemos que recurrir a otros mecanismos de acción farmacológicos, por ejemplo, los beta-bloqueantes. Los fármacos beta-bloqueantes o bloqueadores de canales de calcio son dos tipos de medicamentos que podemos usar para disminuir la presión arterial en estos pacientes, porque si le damos diurético va a ser lo peor, ¿no? También pacientes que son eritrocitóxicos en cuanto a la dieta tienen que disminuir el consumo de vegetales con coloración verde oscura, porque estos vegetales verdes oscuros tienen folatos, ¿no es cierto? Entonces va a incrementar la producción celular y va a aumentar el hematocrito. Entonces, ese sería un ejemplo de terapéutica, porque en esta enfermedad es más importante, de hecho, la terapia física, la alimentación, evitar el consumo de diuréticos que la propia terapia farmacológica con atorvastatina o con ASA, que son más preventivas. Por ejemplo, la aspirina es más para prevenir que se formen coágulos, ¿no es cierto? Como terapia antiagregante plaquetaria. ¿Ok? Entonces, esta sería la diferencia, ¿no? En cuanto a terapéutica y tratamiento médico. Okay, so we have the last one, who is Paola. Hello, Paola. Are you here? Paola, are you here? I think she's not. Okay. We're going to leave this for tomorrow's class, okay? Surgical treatment. And again, guys, I'm sorry for yesterday. Tomorrow we're having our next theoretical class, and then we're going to have our practice class tomorrow with the surgical treatment that is much shorter than medical treatment. Okay, guys? So have a good night, and I'll see you tomorrow. Take care, guys. Sorry, before you leave, please, let's do the survey, please, and let me know when you're done.
I finished.
Okay, thank you. There's some people left. Okay, thank you, guys. I'll see you tomorrow. Have a good night's sleep, and we'll take care, okay?